Welcome back to my channel by Rita. Today I'm going to take you through the verified websites that I will be using. So I'm going to take you through 5 of them because these ones are the ones that I use or have used in the past and have got my jobs, and I know how it works and I want to explain that to you. I'll also be demonstrating one of them, the key one, to you because I want you to be able to understand that website. It's really important. I'll tell you which one. We'll probably leave it for the last so I can demonstrate it to you, show you the screen and how to get in. But first of all, let's just do a very quick recap. You obviously know now that the UK government has announced that they'll be adding care worker role to the shortage occupation list. And that means that people can come in and do the job from overseas. It's now open to overseas, not just the EU. And you can earn up to £20,480 annual salary, or £10 10 pence an hour. And this is one of the qualifying things, the financial requirement for you to get your visa, the care worker visa, 3 to 5 years thereabouts. And you can continually renew this. And this is also a route to go ahead and get your indefinite leave to remain. So really good opportunity. And we are waiting for a date. February 15, 2022 is the date we're all waiting for, hopefully, to get a particular, the announcement to be finalized actually, and just make sure that everything is open and all the care homes and the agencies, the healthcare sector in general is ready and prepared to welcome you in. All right, so let's crack on. So the 5 websites, they're organized, okay? You can go in and you open up your register and open up your account, save things, come back. And there's a reason why I'm giving you these ones, but other ones also are just, they're there. So don't feel that these ones are the only ones you can go to. Go to others as well, but these are my 5. So read, www.read.co.uk. Okay, and there you would see, if you went there straight away now, just put that in. So read, I'm sure you will know them, they're huge. You will see job vacancies, all sorts. You will find them there. Care worker roles, senior healthcare workers, just everything. Okay, healthcare jobs, a lot of them come up on that, and you can go ahead, search for what you want, search for the region you want as well. Don't forget that the UK might be a small island, but it's big enough. So you know where you're going to. You're going to the north, you're going to the south, you're going to the west. Where are you going to? Manchester, Liverpool, where. So decide where you want to go to. Scotland is also there. Amazing place if you ask me. And decide and then go ahead and find your job. So that's the first one. The second one, this one is actually quite good. I would use this most definitely, and I have used this definitely, is TrackJobs, TRAC.jobs. And this is because quite a lot of NHS trusts now use them to handle their recruitment process when it comes to your statements, your personal statements, the application. In fact, the application process itself, TrackJob handles that for quite a few trusts. A few of them, I have applied for jobs there, and I was required to. The next thing I knew was I got a message from TrackJob saying, log into your account. If you've not registered, register now. Log into your account, and then you'll be able to monitor. You get your messages there. You get your interview notification. So some of these, why I'm saying these 5 is because they're very organized, and I know that you can actually manage the entire journey of your employment, whatever employer you've chosen, be the NHS, be it a care home. They can manage that process for you. And when you do get the job, there are messages, etc. So TrackJobs will be the next one, all right? And Total Jobs is another one. TotalJobs.com, you would go on there, and also straight away, numerous vacancies. You would find that there. So Total Jobs, I will leave all the addresses in the description, okay? Number 4 would be UKindeed.com, another big one. Even if you did not remember where you were going in particular, you just put in the care worker role, jobs in UK, vacancies, etc. These are the names that would come up because they're the bigger ones. These are the huge ones, okay? So I would be sending you there to say, go and have a look and try and find what you're looking for. Don't forget financial requirements for this particular visa. You're looking for a role that would be prepared to pay you 20,480. Don't forget that amount, because it's really important that that is what you're earning annually to be able to qualify for the visa. So anything other than that, anything lower than that, if you get more, why not? But anything lower than that, not now, okay? There's a reason why. You know what you're aiming for, right? And then the fifth one is the biggest one, and I am going to demonstrate that now. We'll fire up the laptop and I'll show you how to go into there. And that is obviously big boy www.jobs.nhs.uk. We got that in the end. And this is obviously, as I told you, my previous episode, the biggest employer really of labor in this country, and of course they are the ones to take care of. We have professionals, huge, absolutely huge. Okay, they are employing left, right, center, all over the country, Scotland, Wales, the NHS is everywhere. So you want to most definitely have a look at them. And if you watched my the last episode, I said to you, I might not know for certain, I can't say rather for certain, that when you go in there, they would be happy to sponsor you at this level, the care worker level for now from overseas, only because we're waiting for the date 15th, okay? 15th, don't forget, 15th of February 2022. However, I do know that they're definitely taking senior carers. They do have, so I should say this to you, with the NHS, okay? You might not hear this so much in the care homes or the agencies. They will say, oh no, we don't use that, but they do, actually they do. But you will hear this a lot. You hear the bands, okay? Once upon a time we had band 1, but I think the government didn't. So now it's a case of you hear band 2, which is the starting bit. So that's where you'd find most of the care workers and other key workers and other multidisciplinary members of the team in the whole sector. You'd find them at level 2. So that would be your band 2, and then the band 3, 4, it goes up. I think it goes up all the way to probably the 9, if I'm not mistaken. You're talking about the directors and yeah, something like this. So for this particular care worker visa role, you'll be looking at the one that's been open to yourselves is now the band 2, whereas previously for you to get the tier 2 visa, the tier 2 worker visa, before now, it would be a level 3, which is a band 3 in the NHS. So very exciting news that this is going to be opened up to the band 2s, because that means that what NHS was doing previously is that they would only recruit in-house. When I say in-house, I mean in-country, for the band 2s. But now yourselves from overseas can be recruited by the biggest recruiter in the country. So straight away, my first advice would be go ahead, go and register. Have an account on the NHS Jobs website. It cannot hurt. Go and have a look. Even before you register, you can search without registering, first of all. Just have a taste of it. Open it up, have a look. I'll take you through that very quickly and show you how it goes. And why I want to take you through that is because it's quite elaborate. Oh no, elaborate is not fair. It's quite detailed. See what I did there? Chose my words carefully. It's quite detailed. If you do not like step by step, tell me where your grandma lives, where's your mommy's hair comb, where's your daddy's shoe, NHS is going to do something to you, because when it comes to that page, it is detailed. They want everything, okay? It's all broken down. I want this about you, I want that about you, tell me this, tell me that. So you want all your records around you. Try and get yourself prepared and take your time, because you can save these things, can't you? You go on there when you get to the point where you're like, oh, tired now. You save it, you come back another time, you come back another day, you carry on, okay? So it's a process. So, like I said, I'm going to show you that straight away. But before that, quickly, you want to be thinking about when you go into this, especially the NHS Jobs website, you're thinking about quite a few things. Any trust, we call them the trust, foundation trust, any NHS foundation trust that you're applying to the hospitals or wherever on the NHS website, you're going to be thinking about the organization's core values. You will hear this, the organization's core values. They have their own values and they expect you to align with this, okay? You have to, okay? If you're going to be one of the employees, you have to match them and they have to match you. So when you're looking at that, things you're going to see that will come up, and I will just tell you now straight away, you're going to see things like the organizational values, you're going to see the person specification and the job description. You might get other additional information or additional documents on the website. It's all there. The website is big, and we'll go there straight away now. You will see things that will guide you, more documents, information. You can read up on them, have a feel of that. Because even if you're not coming into the country straight away to work for the NHS, I will hazard a guess that if you were going to carry on in this career, at some point you will be working for the NHS, or at least providing services to the NHS. So I would say if you want, well, you can have a long career in a care home. You can climb up to be the manager of the care home, clearly. But at some point, if you wanted to diversify, if you wanted to go into other, I'm a clinical research nurse now. And of course, I'm not doing that in a care home. I'm doing that with the NHS. At the moment, yes, I am. I won't go into the details of what I'm doing now, so let's forget about me. My point is, you want to definitely be able to go in there, search for jobs. Jobs are plenty all over the country, the entire United Kingdom. There are jobs, so don't miss out. All right, so let's go over now and go have a look. Yeah, okay, let's just go quickly to Google. You just type NHS jobs. It's the one website that will come up. So basically this is what you see. Okay, straight away, and do your registration, put in your details. If you've had that before and you saved it, then you can just go in and log in. So you see, yeah, email address, password, and as you register. But even if you haven't done that, we just wanted to check things quickly. Let's have a quick search, keyword search. So you can either use keyword or you'll use the location. Sorry, mine is a touch screen, so I'm just going to crack on with that. So, care support worker. As you can see, band 3 there, clinical support. And if you come to the left-hand side, you can refine your search. You see what I was talking about? The agenda for change is what that's called. AFC, agenda for change, pay band. So the NHS uses that, okay? It's standard. So you can see band 2 all the way to band 9 at the bottom. I'm referring to these. I don't want to press it because it's touchscreen. But okay, I said I didn't want to do it and I did it. Go on then. Right, so band 2. Let's refine the search with that and let's see what's going to happen. Apply your filters and just click on that. If I show you this, NHS professionals, they provide services, or they provide staff specially to the NHS, and they, as you can see there, that's a bank healthcare assistant, so that's temporary. But theirs is £10.19. What you need is £10.10. Remember, so that's definitely up to and more than the 10.10. So what you've got there is 10.19. So you've got to come and do the search for yourself and pick out what, what applies. There's lots of that going on. Let's see if we can go down and find. One thing I should say to you as well is you're going to find out that with the care workers, someone specialist role, so they will pay you far higher if you've got specialist skills. So in as much as you don't need it to start up and get the generic job out there, I would advise you, if you can, especially those of you who have a background in healthcare or sciences or whatever, I would advise you as much as possible whilst you're waiting. 2-3 months, are you doing an IELTS exam? Are you doing the NVQ3? Some of these things you can do online and you can do them quite quickly within the next 2 months or thereabouts. You get these things. That London Northwest University, Southall, Healthcare NHS Trust, they are definitely paying more, but this is because it's endoscopy. Now, endoscopy is a specialist area. I should know because, yeah, that was there. Anyway, but some of you might have that skill already. So if you do know how to take your biopsies, or, well, not you wouldn't be taking the biopsies, it's the nurses that will be taking the biopsies. But if you do know how to support, so the care workers will remember the healthcare assistant or care worker you hear is interchangeable. is to assist. All right, you assist the qualified, well, we call them the qualified healthcare professional you're working with. So if you're helping with labeling the pots for the biopsies being taken, things like that, you're washing up the endoscope. These are skills that they would be requiring there. You know how to help when they're recovering the patient. When you're done with the surgery, you take them out to the recovery area. You're assisting in taking observations. There are many things. Okay, so this is a good example. Just having a quick look at what's available today. There's a lot of bank. I didn't click on bank. I don't know. I'm seeing so much bank, but this is a good example that not all of them at the moment would be giving you that amount. Of course, some of this is negotiable. If you do have experience, you could be saying you want the next band up, or you could be actually in the same band, you have different levels of pay. So I don't remember what it is, but even as a band 2, if you have experience, if you can show or prove that you've been paid at a certain salary or you have experience, you can negotiate your pay. So if that is saying, for example, where's the one I was just looking at now? There was one, accident and emergency in Frimley, and that says 19612 to 20984. You could be saying, well, actually, I will not be working for you except you pay me at minimum 20, I don't know, 2,900, 2,500, okay, 20,500 per annum. This can be negotiated. But there are quite a few. You can see the pages go all the way down, just carries on. Page 1 of 38. So there are lots, but you have to put in that time and do some searches. And pick out what works for you, what area, So I just wanted to show you what's live. And when I was trying to explain that at the moment, they might not necessarily have that. I mean, look at this with support worker, Welton, LCM Healthcare, up to 23,000, plus 2,000 welcome bonus and benefit. Woohoo! Don't mind if I do. So there. Just have a look. You're going to find that with the NHS professional, just about to say that again, what you're going to find is that the agencies, most of the agencies, not so much the care homes, some of the care homes, the private care homes, and lots of the agencies actually pay way higher than this at the moment, okay? But I would say career-wise, and keeping an eye, don't forget, for that date when this becomes properly official, some of these may actually be adjusted. Once again, NHS professionals seems to be doing a really good job. I remember from when I first started or tried to get a job with NHS professional, I remember off the top of my head that they wanted 6 months experience. Then anyway, I don't know what it is now, so we could be having that conversation now to find out, because clearly they are giving you above the 1010. You can see that's 1019 there. That one is 1138 an hour. So yeah, okay. So this is just a feel of things. Let's just jump to a random page 5. So I'm doing this basically. I'm sure if you have your own internet access, you don't need me to do this for you. But not spend your money on your data for nothing. You're already watching me. We could just use the opportunity to show you. So can I make this bigger? Yes, I can. Woohoo! ECAT healthcare support worker, accident and emergency. Bats Health is a huge one here in the London area, and look at that. Can you see that? So support worker. Band 2 support worker, and that is 23. What you needed was much lower than that, so this is 23 per annum. It's good, no? All right, let's go to band 3. For those of you who are level 3, the senior care workers. So is it Oxford? Oxford is a lovely area, lovely part of the country. Band 3 level. Your pay in band 3 is so much higher. Some of them are not so much. So that one says senior nursing assistant, adult critical care, guys of St. Thomas, absolutely massive. And that's 24,938 annual salary. So you search as well, and then check the other sites and see what they're offering today, see what's up. Okay? And of course, if you'd registered, all these things will be working. Add to favorites. You can save what you like and come back to it and apply for it. And the beauty of the NHS website, the jobs website, is when you register, you have your account, and you have your generic information saved in there. It remembers it, so you can apply for as many positions as you wish with little effort. Okay, once you've done one and you saved it on your profile, so that your what would that be called now? It's called your profile. You save it, it will remember. So it's like having your CV there. It remembers who you are, what you put previously. So all you have to change is the new one you're applying for this time around, and then maybe your supporting statement, because it's generic to, it's applicable to most of the same band. If it's still band 2 you're applying to, or there's still band 3 you're applying to, and you just say, oh, for this role, because this is going to be in radiology, this is going to be in elderly care, you now make it specific to elderly care, you now make it specific to endoscopy or radiology or whatever. So I think that's all. So I'm giving you a feel of it. I don't know what just happened there. This touch screen, you get shakara. Anyway, right. I hope you enjoyed seeing that. So now that you've seen how that works, go in there, register, have a play about, see how it, how it works. Just start to do your own thing. Start to save some information. If you already have your educational, background, your records, your employment history, you can put some of those things there. It does take some time. You might think, oh no, I'll do it when I'm ready, but trust me, by the time you start to remember some dates and what you did where and for how long, you might have to be going back and forth. So start now, start to register these things, and you can save it. Get in early, that's what I would say to you. Get in early. You have any questions, put it down there in the comments below. Talk to me, let me hear your questions, and let's start to answer these things, because if I don't know what you're struggling with, I cannot necessarily meet you at the point of your need. So let me know what you're struggling with, and we will do the next episode and start to break more of these things down. And we're waiting for the big date, remember, the 15th February. So we will have a countdown to that, and we'll be ringing the care homes, as many as we can, to hear from them if they're very happy to have you straight away. Okay, so start doing your homework and share this video. Share this video, put your notification bell on, and just make sure you don't miss any episode, because I will only come with information that's relevant to you. Okay, thank you. I'll see you on the next one. Yeah.